Hi, Barb. So I have your patient here. I have Annie Stevens. She's 45 years old. She's in room 1704. She's a G1 PT1. So she had a cesarean delivery about 4 hours ago that was emergent. She does have a history of hypertension and type 2 diabetic. Her baby boy had an APGAR of 6 to 7 when he was born. He was 10 pounds, 4 ounces, and his pediatrician is going to be Dr. Armstrong. Mom was, again, an emergency C-section at 38 weeks, and she is blood type O. Baby was GBS negative, rubella non-immune, hepatitis negative, RPR negative, and HIV negative. She has a cesarean horizontal incision in her lower abdomen. There was 950 milliliters of blood loss. There was no complications during the surgery. She did have epidural placed at L5. Right now she's at level T8 bilaterally, and I was using a cotton ball for that. She plans on using formula for feeding, and her vital signs were, when she came back, 150/60, 98.7, heart rate 95, and her respiratory were 22. All right, now baby boy is 6 hours old. He peed everywhere during delivery. He has not have a bowel movement yet. He has no interest in a bottle, and he's very sleepy. Vital signs for him was 98.6, 155 for heart rate, 40 for respiratory rate, and blood sugar of 70. So Annie is very upset. She really wanted to have a vaginal delivery. She feels that nothing has gone right. Nothing has gone the way she has wanted it to. This pregnancy was a result after 2 failed attempts at IVF. She told me that she's never felt so defeated, and she feels that she's kept her blood sugar within defined limits during this whole pregnancy, and also she has done everything to keep her blood pressure low. She did need this emergency C-section because her blood pressure increased. It kept going up and up. She was at 180/80, and so an emergency C-section was performed. After delivery, she reported no pain. Right now, she's about a 2 out of a 10. She has a very flat effect. She is refusing to hold the baby. She won't even look at the baby. Her fundus is firm. She has moderate blood flow. She does have a Foley catheter placed, which after I started at 7 a.m. today, so 7 p.m. right now, she has an output of 870 for the day. Baby boy Eddie is sleepy. Still no interest in taking a bottle or a pacifier. I have him loosely swaddled, and the partner is at the bedside holding the baby, and her name is Patricia. I have concerns about mom and baby. First of all, mom, I am afraid of postpartum depression, and also hemorrhage. Also, for the baby, I feel that the feeding is going to be a little difficult because he has had no interest so far. Also, a bonding delay because mom has refused to hold the baby or even look towards the baby. So I was thinking that not tonight, but maybe tomorrow it could be recommended that, well, maybe tonight if they're still available, but maybe a social worker could come in and talk with them, or a therapist, just to kind of go over what she's experiencing right now, and just to have someone unbiased listen. I did put in that a home visit would be good, just to make sure that after mom and baby leave, that both are on the right track. Baby's gaining weight, and mom is no longer having any depression type symptoms or rejection type symptoms with the baby. And that is the report on Miss Annie. Is there any questions you have? No? Okay, have a good night.